when we're dealing with the ball and socket joint of the hip, remember that the femur bone is the shaft of your thigh and it fits into the socket of your hip. Now there are many different stretching maneuvers that I'm going to teach, but today I'm going to zoom in on just the socket itself with a very light motion technique called a circumduction exercise. So it addresses the socket and the way the femur bone fits into that socket. Okay, so I like maneuvers that are very quick and simple to do. This can be done anytime you're in the seated position or anytime you're lying down on your back. Okay, so we're going to talk about that hip joint. Remember, it's the ball and socket joint. This also is good for the bursitis, so the trochanter on the side, or the femur bone socket that fits in right here. Okay, so what you want to do is you want to hold your knee like this, and then you're going to, using your strength of your arms, pull your knee up, and then with your arms, move your knee in a circle. Do about 15 to 20 circles one way, and then 15 to 20 circles another way. Mostly using the strength in your arms rather than the strength in your legs. So this is passive motion. Your femur bone fits into the socket, the ball and socket joint, and it's a light circular motion. Notice I'm putting emphasis on therapeutic motion rather than hard stretching. This has a shaping effect on the socket, the synovium, the cartilage of the joint. If you do this before you roll out of bed in the morning or in the middle of the night, or if you do it when you're sitting at home, it fits my main criteria for an exercise that most everybody can do. And that criteria is I want an exercise that can be done quickly, kind of on the fly, doesn't take any special classes, doesn't take any special equipment, using just your own weight of your body and your own muscles to do the movement. Okay? So remember, it can be done anytime you're seated. So you're pulling the knee up, doing about 20 circles one way, using your strength in your arms primarily, and then 20 circles the other way. Okay? Make sure you do the opposite side as well, not just your painful side. Remember, our objective is to target the shaft, ball and socket joint of the actual hip itself. Some people refer to this as the hip back here. That's actually not accurate. This is the hip joint in here. And this is called the circumduction exercise. Remember, you can also do this lying flat on your back. So we want to keep this simple. Try to do this exercise at least morning and evening. If you have chronic hip problems, try to do this exercise 3 to 5 times every day. Frequency is important, especially with a very light motion, therapeutic motion technique. Notice that I'm not asking you to do any deep hip stretches at this time. If I want you to do a more deep, localized stretch, I'll take you aside and instruct you to do that. So this is an exercise that everybody can do, even as a preventive, so you don't have to have hip problems to get the benefit of this exercise.